Good afternoon. Here is our latest update on COVID-19 in Pennsylvania. As of 12 a.m. this morning, we have 825 new cases of COVID-19. This brings our statewide total to 50,092 Pennsylvanians who have tested positive for COVID-19 in all 67 counties. This number includes 3,084 positive cases now in healthcare workers. In addition, it includes 9,345 positive cases among residents of 494 long-term care living facilities, which include nursing homes and personal care homes. Tragically, 2,458 patients have passed away from COVID-19, and to date, all of our deaths have been in adult patients. As of 10 a.m., hospitals are reporting that approximately 2,689 patients are currently hospitalized due to COVID-19. 553 of those have required the use of a ventilator or a breathing machine. Across our healthcare system, approximately 46% of hospital beds, 40% of intensive care unit beds, and nearly 75% of our ventilators are still available. While we have focused our efforts to stop the spread of the infectious illness COVID-19 and the worldwide pandemic, Pennsylvania's largest public health epidemic in almost a generation has not stopped, and that is the opioid and substance abuse crisis. Pennsylvanians are working every day to manage their substance use disorders, including opioid use disorder, in a time where the networks that they rely upon can be very hard to access because of social distancing. And we need to know that there are Pennsylvanians in need of drug and alcohol treatment, even without the added stressors associated with COVID-19. What hasn't gone away is our continuing efforts to get people into treatment and to help them recover. The Department of Drug and Alcohol Programs Get Help Now hotline is still connecting Pennsylvanians in need of treatment, including inpatient and outpatient treatment. That number is 1-800-662-HELP, or another way is 1-800-662-4357. Again, 1-800-662-4357. And this will connect you directly with substance use and alcohol use disorder treatment and resources. Before COVID-19, we were working tirelessly to strengthen the entire drug and alcohol system's continuum of care by expanding access to medication-assisted treatment for opioid use disorder throughout the Commonwealth, establishing warm handoff protocols, strengthening relationships on the local level and the county level, pushing millions of dollars from the federal government into our treatment system, and supporting a robust recovery network. All of those efforts continue. And every Pennsylvanian can still visit a pharmacy today and access the life-saving overdose prevention drug naloxone because of the standing order prescription that I signed 5 years ago. This is a very stressful time for all of us, but if you know of someone who may be at risk of an overdose, including individuals in early recovery, please reach out to them and see if they need help. We should not underestimate the power of a phone call to check on individuals and offer support to our friends and our loved ones. Substance use disorders can last a lifetime. Addiction can happen to anyone. And now, more than ever, Pennsylvanians should know that you are not alone. And here are my daily reminders. Please wash your hands with soap and water for at least 20 seconds, or the time it takes to sing Happy Birthday twice. And use hand sanitizer if soap and water are not available. Cover any coughs or sneezes with your elbow, not with your hands. And don't touch your face, especially after touching surfaces. Clean surfaces frequently. And if you have to go out for life-sustaining activities, please wear a mask if you're going to come into contact with others. If you have questions about your health, please contact your healthcare provider. And if you need mental health resources because you or someone you know is experiencing a mental health crisis, please contact the crisis text line by texting PA to 741-741, or call the statewide support and referral helpline at 1-855-284-2494. Again, 1-855-284-2494. For the most reliable information related to Pennsylvania's response, please visit our website at health.pa.gov. And what is most important for Pennsylvanians to remember is stay calm, stay home, and stay safe. And now I'm pleased to answer questions.
Thank you, Secretary. Our first questions are similar from ABC 6 and WHYY. Delaware County officials in suburban Philadelphia are asking that your office separate their positive cases in nursing home facilities from the general population in the county cases. The idea is that there are far more nursing home cases since you are basing reopenings on the number of COVID cases, and it should reflect the general population, not the bulk of cases in nursing homes. Is this something that you would do? Is it something you're considering? And do you think it's safe to do, given that the staff leave the facility to shop?
No, we haven't asked this question before, and we're not going to separate nursing home cases from other cases in counties. What we have certainly learned in this global pandemic of COVID-19 is that we are all interconnected. One section of our community, such as a nursing home or personal care home, impacts the general community, and the community impacts that facility. The staff go back and forth. And so it really is an example of how we are all connected, and it's very important to include those type of facilities among other congregate settings in the total counts for a county.
Also from ABC6, now that you have a date for the Northwest and North Central counties to head into yellow, when do you expect to make a decision for the next round of counties and regions?
Well, we'll be getting data starting Tuesdays and then Thursdays about some of our metrics. In addition, we'll be looking at new data from the Carnegie Mellon modeling that they are doing, and we'll be discussing the contact tracing and the laboratory testing in those areas. We will be putting all of that together. We'll be discussing that with the governor, actually starting today and ongoing, and then the governor will make his decision.
ABC6 also asks, even if you okay a region to head into the yellow-green, ultimately, could it be up to the township or municipality to decide?
Well, it's of course done with the counties and local authorities. So I guess if there was a county that didn't want to go into yellow, we'd have to certainly discuss that. But everything we try to do is a collaboration.
They also want to know, do you anticipate that the restrictions in the yellow county category could change? Meaning, do you see the first round of counties head into yellow, use them as a test run to see if more businesses could be opened?
It's possible. So we'll be looking at all of these issues and make all of these decisions in real time.
From ABC 27, the stated goal at the beginning of the shutdown orders was to prevent hospitals from being overwhelmed. In large parts of the state, hospitals have not been overwhelmed. So why not ease mitigation efforts in those areas?
Well, we would not want to ease mitigation in the red zones, in the areas that have the most cases. So an example would be the Southeast. So our goal was to prevent the rise of new cases from following that exponential curve going straight up in terms of number of new cases, number of deaths following that type of curve as well. And then those patients would overwhelm the healthcare system. And we were successful. The mitigation efforts flattened that curve, and we did not see that continued exponential rise of cases and deaths. And the healthcare system, although challenged in Philadelphia, has stood up very, very well. However, all of our modeling suggests from many different sources is that if we release the mitigation efforts too soon in areas that are very affected by COVID-19, areas that still have significant community transmission, then we would just go right back into that type of exponential rise, and it could even be higher than the rise we saw before.
Also from ABC 27, since 2/3 of the deaths have occurred in nursing home and long-term care facilities, and nearly all of the deaths have been in people 65 and older, was our initial strategy a bit misguided? Should we have been more aggressive in closing down those vulnerable facilities and protecting people with exacerbating conditions, but less restrictive in other areas?
No, I don't think that our initial and our continuing plans have been misguided at all. We want to protect the entire population from COVID-19 and its serious side effects. But it is correct that the majority of deaths have been in seniors, and particularly seniors with other comorbid medical conditions, such as heart disease, lung disease, diabetes, etc. Of course, that is a great example of the type of individuals that are in nursing homes, seniors, many and if not most with comorbid conditions. It would not be possible to close all of those facilities. There are 695 nursing homes and several thousand personal care homes, all taking care of predominantly seniors. So, and we have been working very hard throughout this entire process on protecting those homes as much as possible. It's a significant challenge, and we're continuing to do the very best we can to protect the residents and the staff in those facilities.
From CNHI, Governor Cuomo announced that New York and Pennsylvania and other counties will be jointly purchasing PPE. Can you explain what PA stands to get out of this when the partnership will begin?
Mm-hmm. So that will be organized by the Governor's Office and the Department of Community and Economic Development. So I don't have any granular details, but they'll be working on that program with the regional approach in the future.
Also from CNHI, when counties move to the yellow phase, will workers be required to wear masks in the workplace? And will shoppers need to wear masks? Or will that be a recommendation rather than a requirement?
Well, it's a strong recommendation. The governor has said all along that he feels that Pennsylvanians want to and will do the right thing. In the yellow zones, the right thing to do is to continue to practice social distancing and to continue to wear a mask when you're in public. So we are strongly requesting that individuals who are working in retail, etc., wear masks, and that those customers that are going into those stores wear masks. And so we all feel confident that people in Pennsylvania will do that.
From Fox 56, a few weeks ago, there wasn't much race data. When the governor and lieutenant governor started a task force, then the governor and lieutenant governor started a task force. Where are we in terms of race data and what those numbers are showing?
Mm-hmm. So you're correct. It is very important to be able to get data on race and ethnicity as part of our data in terms of the laboratory analysis and the test results. That is required as part of our reporting system, but with the rapidly changing landscape of COVID-19, we know that hospitals, medical personnel, and laboratories had not been doing that. We are making progress. So previously, only about 10 or 15% of the data was coming through with race and ethnicity. Now it's a third. It's better, still not good enough, and we're going to be continuing our efforts to have all of those filling out those laboratory forms to give us that very important data.
From WTAJ, what are the key factors for Center County and other counties in the yellow to ensure they continue to move forward to the green phase?
Well, the real important thing is to prevent the community spread and transmission of COVID-19. The way people do that is still to stay at home as much as possible. But in the yellow zones, there are more liberal interpretation of that. So you can go out to stores and people can go to work. We are still asking that people telecommute as much as possible. We are still asking that if people are getting goods that they need, that they either order it online, or if they're going to a store, that there's curbside pickup. But if that's not possible, we want people to wear masks, both the staff in the store and the customers. We certainly want people to continue all of the efforts that I discuss every day in terms of hand washing and not touching surfaces and all of those daily reminders. So if we all do all of that, then areas and counties will be able to go from yellow to green.
Also from WTAJ, for counties below the threshold, what do they need to do to go from red to yellow?
Well, we're going to be looking at that. So we need to continue all of those different measures that we just talked about in terms of social distancing. And then we're going to be looking at the data this week and the metric that we've discussed before, but then the Carnegie Mellon data and other data that we're looking at, as well as our ability to be able to expand testing and contact tracing. We will put all that together and discuss that with the governor, and the governor will make his decision about which other counties can go from red to yellow.
Finally, from WTAJ, how often will new counties be moved into the next phase?
There's not a specific timeline, so we'll do it whenever the data and all of the other measures I just discussed suggest that those counties should.
From the Philadelphia Inquirer, county officials in suburban Philadelphia have asked today that the Commonwealth prioritize increasing testing in the hard-hit region around Philadelphia, which they called the economic engine that drives the state economy, and should be given the tools needed to reopen soon. Will you be prioritizing this region when it comes to diagnostic testing? And if so, how exactly will you do that?
Well, we're looking to expand testing throughout Pennsylvania. So we have discussed, for instance, in Philadelphia with Commissioner Farley expanding testing. We've discussed in Allegheny County with Commissioner Bogan about expanding testing. We have a plan that's on our website to expand testing in the yellow zones. In addition, we'll certainly want to expand testing in the suburban collar counties of Philadelphia. We'll discuss that with their county and municipal health departments. And we do have the mass testing site that is still in Montgomery County.
From ABC 27, on the topic of summer swimming, is there a scenario that could see pools reopening this summer? And if so, what would be the criteria for reopening, and is there a timeline for this?
So there is no timeline, and so we will discuss that. We just started in May, although the weekend was very nice. So we haven't made firm decisions about pools yet, but as the time gets right in terms of going into summer, and depending whether counties are yellow or green, we will make those decisions.
From WKOK, UPMC doctors say the pandemic never turned out as widespread as predicted or as deadly as predicted. What is your view on that remark?
Well, I am very pleased that with all of the mitigation efforts, the closure of schools for the remainder of the school year, the stay-at-home orders, the closure of non-essential businesses, that we were able to bend and straighten the curve so that we did not have the size of the peak, the surge that we were talking about, and it didn't overwhelm healthcare systems. I think that is a success. So we need to continue efforts going forward as we start to open up Pennsylvania to continue that success.
Also from WKOK, liability issues have seemed to be popping up in workplaces. Do you have guidance for these employers?
Well, I'm not an attorney, so I don't have specific guidance about liability, but I know those discussions are going on with the governor's office and the Office of General Counsel.
Lastly, from WKOK, transphobic people have been making comments about your appearance throughout the pandemic. Do you have a message to those people?
Well, my message is that, as Secretary of Health, I am working with the governor's office, advising the governor, as well as working with other agencies to the best I can in terms of helping Pennsylvania through this unprecedented global pandemic. I realize at times like this, it's very stressful. People sometimes say things that they wouldn't otherwise say or mean. But really what I'm going to do is stay laser focused on helping Pennsylvania through this global pandemic and assisting the governor and the governor's office.
From NBC 10, recently you announced that non-emergency medical procedures can resume. What is the status of dental procedures, including cleanings? Are they allowed to resume as well?
Well, we're working on dental guidance as we speak. We hope to have that released by the end of the week in terms of the guidance throughout the state.
From WNEP, daycares in counties that move into the yellow phase will be able to reopen. What kind of guidance will be in place to make sure that children in those facilities stay safe?
Well, that's really, really important as counties go from red to yellow. And so we're going to be working with the Department of Human Services, which regulates those child care centers, on guidance.
From the Daily Press, readers are asking, why can't the Department of Health indicate how many of a county cases come from individuals who are diagnosed out of state and who only count towards their county total because that's where their primary residence is listed? Wouldn't this information be helpful for the public to know, especially for counties with low numbers as they begin to reopen?
Well, that's not how our system works, and our system is guided by the Center for Disease Control in the federal government. So the cases of someone who resides in another state count towards that state. That's how the data system works, and so we follow the CDC federal guidelines.
From WNEP, a viewer asks if blood type is a factor in determining a person's risk of contracting COVID-19.
I have not seen that in any study.
From the Scranton Times-Tribune, in the last 2 weeks, the number of cases in Lackawanna County has surged more than 50%, while neighboring Northeast counties have seen increases of less than 30%. Any idea what's happening there?
Well, so actually we've noticed that, and so we're going to be doing a deep dive in the data to look for the specific reasons why the numbers in Lackawanna County have increased. Of course, Lackawanna County is near some other counties that have had significant cases, Luzerne County, etc. But we're going to have to do a deep dive in terms of the numbers in Lackawanna County.
From the Scranton Times-Tribune, on April 23rd, for the first time since the outbreak, the percentage of positive tests among all tests dropped. It peaked at about 20.8% on April 25th and dropped to about 20.5% in the past few days. What is the significance of that number?
Well, we do have to look at trends over time. Each day's data is very dependent upon the lab results coming due at that time. We've talked before that sometimes we get, quote unquote, a data dump from particularly commercial laboratories, and they send us a whole bunch of results at once. So we have to look over time. But we have noticed that the percentage positive of cases in Pennsylvania has gone down. I think that is reflective of decreased community transmission, and it's a very positive result. However, we still have counties, particularly in the southeast and the northeast, which have significant community spread, and so we have to stay focused on preventing that.
From ABC 6, what is the state doing to make sure protocols are being met in long-term care facilities like nursing homes? Why can't the state do inspections with inspectors wearing PPE? Also, there are reports that patients in these facilities are being roomed with non-COVID positive patients. Why?
Well, so we do inspections. So we do a lot of discussion and consulting with these facilities online by phone, and then also through other types of media. But we do have inspectors, not routine inspections. That was actually discontinued by CMS, the Center for Medicare and Medicaid Services. But in terms of complaint inspections, we still do that, and we can still do that on site. In fact, this past weekend we did one, and we are working in addition with our consultant ECRI to check on that. And I would find it unusual that someone with COVID-19 would be housed with someone without COVID-19. I'm going to have to check on that specific instance.
From WILK News Radio, some of our listeners have expressed concern about COVID-19 symptoms. overlapping with the likes of allergies or flu. Now that restrictions are slowly being lifted, do you anticipate more of the public to register for COVID-19 testing to rule coronavirus out if they begin to have any symptoms? And would it be rather safe to be than sorry if you have a COVID test to eliminate the fear that it might be COVID?
Well, we want any symptomatic individual to get a COVID-19 test. So we discussed this last week. We have liberalized our criteria significantly since the resources that we need to do testing has become much better. That pipeline is much better from the federal government and from other companies that produce those reagents. And so we have more tests available. We want anyone with symptoms. Now, COVID-19 really does not have specific, usually allergy symptoms. So, allergy symptoms, I get that too at this time of year, would be kind of a stuffy nose, maybe a runny nose, some nasal congestion, kind of itchy, runny eyes, and that would not be the main symptoms of COVID-19. The main symptoms of COVID-19 would be cough, fever, and shortness of breath. Certainly someone with a fever wouldn't be having allergy symptoms. There are some other symptoms that patients with COVID-19 can have: a very, very bad sore throat and chills, etc. Again, a little bit different than allergies. Now, in terms of the flu, we're seeing very few, if any, cases of influenza now. So that's you're not having influenza now. So if you have fever and severe cough, to me that is indicative of COVID-19 unless proven otherwise. So you should definitely get a test. If you just have a runny nose and some itchy eyes, that would not be indicative of COVID-19.
From WJAC, you said Friday that drive-in movie theaters could reopen in yellow so long as they practice social distancing. Since then, a drive-in theater has said the Wolf administration said there was an error and they can't. Are drive-in theaters not allowed to reopen? And also, would this mean events like religious services and graduation ceremonies that are using a plan to use drive-ins as an alternate location should also seek other arrangements?
So we've worked to clarify this, and in the yellow zones, drive-in movie theaters can open if they're practicing social distancing. So we don't want people all congregated together to get refreshments, etc., but they are able to open, and if social distancing can be done with those, for instance, graduation ceremonies or religious ceremonies in a drive-in theater setting, then that's okay. But it's critical to make sure that the social distancing that we've been discussing is continued to be practiced to prevent the community spread of COVID-19.
We have similar questions from the Scranton Times-Tribune and the Associated Press related to specifics on nursing home facilities. First, from the Associated Press, why don't Pennsylvania residents have the right to know about the number of coronavirus cases and deaths inside individual nursing homes?
Well, we're discussing whether we're going to be able to release that. It is a balance between patient confidentiality and also the laws and regulations that govern our release of data versus the public's right to know. So we'll be making a decision about that this week.
From Spotlight, PA, Secretary, the state is reporting 424 deaths in Philadelphia. Meanwhile, the Philadelphia Department of Public Health is reporting a much higher number, 727. Data reconciliation takes time, yes, but that's a difference of more than 300. Why has the state's death count for Philadelphia not increased in nearly a week?
Well, we've been discussing this with Dr. Farley. They use a different data system. So the Philadelphia Health Department is independent. We collaborate with them. Again, we talk every day, but they are an independent health department. They use a different data system. So corroborating that data and reconciling that data takes time, and we'll continue to work to make sure it's as consistent as possible.
From the Capital Star, many experts seem to agree that states should brace for a second intense wave of COVID cases in the fall. What has Pennsylvania learned from the first outbreak, and what should be done differently, and what will be done differently in the fall?
Well, so we have certainly heard that. Dr. Fauci and Dr. Birx have discussed that federally through the federal government. We've also heard that from other public health officials really throughout the country. And so we'll need to be prepared for a significant potential increase of cases in the fall. So what we're going to do is take, as was asked in the question, the lessons learned from the spring to implement to the fall. What we want to have available is very, very widespread testing. We would like to have, as much as possible, point-of-care testing, meaning testing right at the doctor's office or in the emergency department that can take, maybe 15 or 20 minutes and not days or at least even 24 hours to get back. We want to be able to have much more expanded testing throughout the state. I think that the antibody testing will also be useful. Hopefully, by that time, in the beginning of the fall, we'll know more about those antibodies and how protective they are, and if they're long-lived, for months at a time. So we'll know a little bit more about that data as well that we can implement from a public health perspective. Then we will be working with the systems that we're putting in place right now, the testing system, the contact tracing system, to make sure that anybody who tests positive is immediately isolated, that we do a case investigation and contact tracing, that those contacts are quarantined, and we're able to stay very much ahead of that. A number of months ago, when we first started to see cases of COVID-19, really at the beginning, all the tests were being done by the CDC in Atlanta, and then the testing was rolled out to the states very slowly. I think we'll be in a much better position in the fall to be able to try to prevent any significant outbreaks and as much community spread of COVID-19. So we're going to be working on that every day to prepare for the fall.
Our final questions from the Pocono Record. Case counts and deaths appear to be decreasing since the weekend. Do you find this to be a promising sign with the reopening efforts right around the corner?
Yes, but one of the things that we have noted is that on Sunday and Monday, we tend to have lower counts, decreased reporting on the weekend, and then usually Tuesday is a higher number. So we will see tomorrow if the trend of decreasing continues or if it rises. Again, changes over time are the most important thing to watch for.
Thank you, Secretary. That concludes our health briefing for today. Our next briefing will be tomorrow. For any reporters whose questions we were not able to get to, the Department of Health Communication Office will respond within the next 24 hours. Thank you.